6 changes in your prostate after 60, intimacy and your health. Over 60 and curious about how your intimate moments affect your health? Many men aren't aware of the subtle yet significant ways their bodies react to intimacy, particularly in the prostate area. This video explores 6 crucial changes that occur in your prostate during and after intimate activity, offering insights into how these changes can impact your overall well-being as you age. Understanding these shifts empowers you to make informed decisions about your health and habits. Stay tuned until the end to uncover valuable information that might just change how you think about intimacy and its connection to your long-term health. Change 1. The potential link between intimacy and prostate health. Regular intimate activity can help clear out excess fluids that naturally accumulate in the prostate. This natural cleansing process can be likened to a gentle flushing action, helping to remove stagnant prostatic secretions and potentially reducing inflammation. Think of it like regularly flushing a pipe to prevent buildup and maintain smooth flow. This can bring a sense of relief and reduce potential discomfort or pressure in the pelvic area. For men over 60, the prostate can sometimes become enlarged due to benign prostatic hyperplasia, BPH, a common condition. This enlargement can sometimes lead to increased fluid retention and discomfort. Regular intimate activity can offer a natural way to alleviate some of these symptoms by promoting the expulsion of these fluids. However, it's important to differentiate between normal prostate congestion and more serious conditions like prostatitis and inflammation of the prostate. While intimacy might offer temporary relief from mild congestion, it's crucial to consult a doctor if you experience persistent pain, burning sensation during urination, fever, or other unusual symptoms. These could be signs of an infection or other underlying issue requiring medical attention. Consider Bill, a 68-year-old who experienced mild discomfort in his pelvic area. He initially attributed it to age-related changes, but noticed it worsened after periods of inactivity. His doctor recommended increasing intimacy as a natural way to alleviate the congestion, explaining the potential benefits of this natural flushing mechanism. Bill cautiously incorporated this advice into his routine, starting slowly and gradually increasing the frequency. He found that this simple change made a noticeable difference in his comfort level, experiencing less pressure and a greater sense of ease in his pelvic area. He also noticed an improvement in his overall mood and energy levels. Encouraged by these positive changes, Bill continued to prioritize intimacy as part of his overall health and well-being strategy, alongside regular exercise and a balanced diet. However, he remained mindful of his body's signals and understood the importance of consulting his doctor for any persistent or worsening symptoms. This proactive approach allowed him to manage his prostate health effectively and enjoy a fulfilling life. Change 2. Prostate congestion. Prostate congestion, our second point, is a common occurrence for men over 60. Often brought on by the natural enlargement of the prostate gland, known as benign prostatic hyperplasia, BPH. This enlargement can sometimes compress the urethra, leading to a buildup of fluids and secretions within the prostate. Think of it like a kink in a garden hose. The flow is restricted, and pressure builds up behind the constriction. This congestion can manifest as a feeling of fullness or pressure in the pelvic area, discomfort during urination, or even a reduced urinary stream. While not typically a serious health concern, prostate congestion can certainly impact comfort and quality of life. Regular intimate activity can offer a natural and often effective way to alleviate this congestion. During ejaculation, the muscles surrounding the prostate contract rhythmically, helping to expel the accumulated fluids and secretions. This acts like a natural flushing mechanism, clearing out the prostate and relieving the pressure and discomfort. Imagine squeezing a sponge. The pressure releases the trapped water. Similarly, the contractions during intimacy help to release the built-up fluids in the prostate. Consider Bill, a 68-year-old who experienced recurring discomfort in his pelvic area. He initially dismissed it as a normal part of aging, but noticed it worsened after periods of inactivity. His doctor, after ruling out other potential causes, explained the concept of prostate congestion and suggested that regular intimate activity could provide relief. Hesitant at first, Bill decided to give it a try, starting slowly and gradually increasing the frequency. To his surprise, he noticed a significant improvement in his comfort level. The pressure and fullness he had been experiencing diminished, and he felt a greater sense of ease in his pelvic area. However, it's crucial to understand that while intimacy can be beneficial for managing prostate congestion, it's not a cure for underlying conditions. If you experience persistent or severe discomfort, pain during urination, blood in your urine or semen, or other unusual symptoms, it's essential to consult a doctor. These could be signs of a more serious issue, such as prostatitis, inflammation of the prostate, or even prostate cancer, requiring prompt medical attention. Intimacy can be a valuable tool in managing prostate health, particularly for men over 60, dealing with the common issue of congestion. By incorporating this natural and often enjoyable activity into their routine, men like Bill can experience significant relief from discomfort and improve their overall well-being. However, it's crucial to listen to your body and seek professional medical advice for any persistent or concerning symptoms. Change 3. Hormonal fluctuations during and after intimacy. Third, let's delve into the fascinating interplay of hormones during and after intimacy. Testosterone and dihydrotestosterone, DHT, two key players in male physiology, undergo a series of fluctuations during intimate moments. These hormonal shifts, while generally temporary, can have noticeable effects, particularly for men over 60. During intimacy, testosterone levels typically rise, contributing to increased libido, arousal, and the physical responses associated with sexual activity. After intimacy, however, testosterone levels can experience a temporary dip. Think of it like a pendulum swinging. It rises with activity and then settles back down to its baseline. For men over 60, this post-intimacy dip in testosterone might sometimes manifest as a temporary decrease in energy levels. This is not necessarily a cause for concern, but rather a natural consequence of the body's hormonal response. It's like a brief recharge period after exertion. DHT, a hormone derived from testosterone, also plays a role in these fluctuations. DHT is particularly important for prostate health, as it influences the growth and function of the prostate gland. While DHT is essential for male development and sexual function, excessive DHT levels can contribute to prostate enlargement, a common condition in older men known as benign prostatic hyperplasia, BPH. Therefore, understanding the interplay of testosterone and DHT during and after intimacy can provide valuable insights into prostate health. Let's consider the case of David, a 70-year-old who noticed occasional fatigue after intimate activity. Initially, he was concerned that this fatigue was a sign of a more serious health issue. However, after consulting his doctor, he learned about the normal hormonal fluctuations associated with intimacy and how they can sometimes lead to temporary dips in energy. Armed with this knowledge, David decided to take a proactive approach to managing his energy levels. He incorporated regular strength training exercises into his routine, focusing on building muscle mass and boosting his overall vitality. He also paid closer attention to his diet, ensuring he was consuming a balanced mix of nutrients to support his body's needs. Furthermore, he prioritized getting adequate sleep, recognizing the importance of rest for hormone regulation and energy restoration. Through these lifestyle adjustments, David found a way to maintain his energy levels while still enjoying an active and fulfilling intimate life. He realized that understanding his body's natural responses and taking proactive steps to support his health were key to maintaining his well-being. He also learned that open communication with his doctor played a vital role in addressing his concerns and finding effective solutions. David's experience highlights the importance of understanding hormonal fluctuations and their impact on energy levels for men over 60. By adopting a proactive and informed approach, men like David can navigate these changes successfully and continue to enjoy a healthy and vibrant life. Change 4. The impact of intimacy on blood flow to the prostate. During arousal, blood flow to the prostate increases significantly. This surge in blood flow is a natural physiological response, essential for facilitating the functions of the prostate during intimacy. Think of it like a muscle receiving increased blood flow during exercise. The increased supply of oxygen and nutrients supports the heightened activity. In the case of the prostate, this increased blood flow helps prepare the gland for its role in producing seminal fluid. While this increased blood flow is generally harmless and temporary, it can sometimes lead to temporary swelling or a feeling of fullness or pressure in the prostate area, particularly for men over 60 who may already have some degree of prostate enlargement due to benign prostatic hyperplasia, BPH. Imagine a balloon slightly inflating. The increased volume can create a sense of pressure. Similarly, the increased blood flow to the prostate can cause temporary swelling and a feeling of fullness. For most men, this temporary swelling subsides shortly after intimacy and is not a cause for concern. However, if the swelling is persistent or accompanied by pain or discomfort, it's important to consult a doctor to rule out any underlying issues. Consider the case of Alan, a 75-year-old, who noticed mild discomfort after intimate moments. He initially dismissed it as a normal age-related change, but when the discomfort persisted, he decided to seek medical advice. His doctor explained the physiological changes that occur in the prostate during intimacy, including the increased blood flow and potential for temporary swelling. He reassured Alan that this was a normal response, but recommended some strategies to manage the discomfort. The doctor suggested that Alan increase his fluid intake, particularly water, to help flush out any excess fluids and reduce swelling. He also advised Alan to make some dietary adjustments, such as reducing his intake of caffeine and alcohol, which can sometimes irritate the prostate. Additionally, the doctor recommended some relaxation techniques, such as deep breathing exercises and meditation, to help reduce stress and promote overall prostate health. Alan diligently followed his doctor's advice and incorporated these changes into his daily routine. He noticed a significant improvement in his comfort levels after intimate moments. The discomfort he had previously experienced subsided, and he felt more at ease. Alan's experience highlights the importance of understanding the impact of intimacy on blood flow to the prostate. While the increased blood flow is a normal physiological response, it's crucial to be aware of its potential effects, especially for men over 60. By adopting a proactive approach, incorporating healthy lifestyle habits, and seeking medical advice when needed, men can effectively manage any discomfort associated with increased prostate blood flow and maintain their overall prostate health. Furthermore, open communication with a healthcare professional can provide valuable reassurance and guidance, ensuring that any concerns are addressed promptly and effectively. Change 5. Urinary function. The fifth point we'll explore focuses on the impact of intimacy on urinary function. The prostate gland, due to its anatomical location encircling the urethra, the tube that carries urine from the bladder out of the body, plays a significant role in urinary function. Changes in the prostate, such as temporary swelling or increased blood flow during and after intimacy, can sometimes affect urination patterns. Some men over 60 might experience a temporary increase in urinary urgency, a feeling of needing to urinate more frequently than usual after intimate activity. This increased urgency can be attributed to the heightened activity and blood flow in the pelvic area during intimacy, which can stimulate the bladder and create a sensation of needing to void. Think of it like the feeling of needing to urinate after drinking a large amount of fluid. The increased volume in the bladder triggers the urge to urinate. Similarly, the increased blood flow and activity in the pelvic area during intimacy can stimulate the bladder and create a similar sensation. Another common experience is a feeling of incomplete emptying after intimacy. This sensation can arise from the temporary swelling of the prostate, which can slightly constrict the urethra and make it feel like the bladder hasn't fully emptied. Imagine a slightly kinked garden hose. The flow of water is restricted, and some water might remain trapped behind the kink. Similarly, the temporary swelling of the prostate can slightly obstruct the flow of urine, leading to a feeling of incomplete emptying. While these changes in urinary function are usually temporary and resolve on their own shortly after intimacy, they can sometimes be bothersome. Let's consider the case of Robert, a 71-year-old who noticed some changes in his urinary patterns after intimate activity. He experienced a more frequent urge to urinate and sometimes felt like his bladder hadn't completely emptied. Initially, Robert was concerned about these changes, but after consulting his doctor, he learned that they were often normal and temporary consequences of intimacy, particularly for men over 60. His doctor explained the physiological reasons behind these changes, reassuring Robert that they were not necessarily a cause for alarm. Armed with this knowledge, Robert decided to take a proactive approach to managing these changes. He started by adjusting his fluid intake. He avoided drinking large amounts of fluids close to bedtime to minimize nighttime trips to the bathroom. He also made a conscious effort to stay well hydrated throughout the day, as dehydration can sometimes irritate the bladder and worsen urinary symptoms. Furthermore, Robert began tracking his symptoms, noting the frequency and intensity of his urinary urgency and any feelings of incomplete emptying. This helped him identify patterns and understand how his body responded to intimacy. He also incorporated pelvic floor exercises into his routine, which helped strengthen the muscles supporting the bladder and prostate, improving his bladder control. Over time, Robert learned to manage these changes effectively and minimize their impact on his daily life. He realized that understanding his body's responses and taking proactive steps were key to maintaining his urinary health and overall well-being. However, Robert's doctor emphasized that any significant or persistent changes in urination, such as pain or burning during urination, blood in the urine, or a weak urinary stream, warrant a conversation with a healthcare professional. These could be signs of a more serious underlying issue requiring prompt medical attention. By being mindful of his body's signals and seeking professional advice when needed, Robert could confidently navigate these changes and continue to enjoy a fulfilling life. Change 6. The circulatory benefits associated with intimacy. Finally, we'll delve into the often overlooked circulatory benefits associated with intimacy. Engaging in intimate activity can be likened to a gentle form of cardiovascular exercise. Similar to a brisk walk or a light swim, Intimacy elevates your heart rate and increases blood flow throughout your body, including to the prostate. This temporary boost in circulation can have several positive effects on your overall cardiovascular health and well-being, especially for men over 60. One of the key benefits of improved circulation is enhanced oxygen delivery to the body's tissues and organs. This increased oxygen supply can help nourish the prostate and support its healthy function. Think of it like watering a plant. Adequate hydration is essential for its growth and vitality. Similarly, the increased blood flow during intimacy delivers vital oxygen and nutrients to the prostate, promoting its overall health. Furthermore, the improved circulation associated with intimacy can help reduce stress and promote relaxation. During intimate moments, the body releases endorphins, natural mood boosters that can have a calming and stress-relieving effect. This can be particularly beneficial for men over 60, as stress can sometimes exacerbate prostate-related issues. Imagine a gentle massage. It eases tension and promotes relaxation. Similarly, the release of endorphins during intimacy can help alleviate stress and contribute to a sense of well-being. However, it's important to be mindful of the potential for temporary blood pressure fluctuations during and after intimacy. For some men, particularly those with pre-existing cardiovascular conditions, these fluctuations might be more pronounced. Consider the case of Michael, a 73-year-old who noticed occasional dizziness after intimate moments. He initially dismissed it as a normal age-related change, but when the dizziness persisted, he decided to seek medical advice. His doctor conducted a thorough examination and discovered that Michael's blood pressure fluctuated slightly during and after intimate activity. While these fluctuations were not severe, they were enough to cause the occasional dizziness. The doctor reassured Michael that this was not uncommon and could be managed with some simple adjustments to his routine. The doctor recommended that Michael stay well hydrated, particularly before and after intimacy. He explained that adequate hydration helps maintain blood volume and can minimize blood pressure fluctuations. He also advised Michael to avoid consuming excessive amounts of alcohol or caffeine before intimate activity, as these substances can sometimes exacerbate blood pressure changes. Furthermore, the doctor suggested that Michael incorporate some relaxation techniques into his daily routine, such as deep breathing exercises or meditation. These techniques can help regulate blood pressure and promote overall cardiovascular health. Michael diligently followed his doctor's advice and incorporated these changes into his lifestyle. He noticed a significant improvement in his symptoms, and the dizziness he had previously experienced subsided. He learned that by being mindful of his body's responses and making some simple adjustments, he could continue to enjoy intimacy without any discomfort. Michael's experience highlights the importance of understanding the circulatory effects of intimacy and taking proactive steps to manage any potential blood pressure fluctuations. By staying well hydrated, avoiding excessive stimulants, incorporating relaxation techniques, and seeking medical advice when needed, men over 60 can effectively manage these changes and maintain their cardiovascular health while enjoying a fulfilling intimate life. Open communication with a healthcare professional is crucial for addressing any concerns and ensuring that intimacy remains a positive and healthy aspect of life. As we conclude, remember that understanding these 6 changes empowers you to take control of your health. Intimacy is a natural part of life, and its effects on the prostate are multifaceted. Paying attention to your body, maintaining a healthy lifestyle, and seeking medical advice when needed are key to enjoying a fulfilling life at any age. Share your thoughts and experiences in the comments below. If you found this video helpful on Life After 60, give it a thumbs up, subscribe to the channel, and hit that notification bell so you don't miss out on our latest tips for living your best life after 60 all for free. We appreciate your support and look forward to seeing you in the next video.